A new method of assessing patients is being credited with reducing waiting times at Australia's busiest emergency department at Flinders Medical Centre. 9 News was granted an exclusive tour of the ED as the hospital continues to tackle ramping.
A chronic illness landed Wendy Templeman in emergency at Flinders Hospital this morning for the second time in 12 months. But this occasion was different.
This was much quicker. There seems to be a lot more communication amongst the staff.
A similar story across the ward.
Probably roughly about 15 minutes.
A new method of assessing patients introduced in February credited for the dramatic turnaround. That new model means senior clinicians rather than junior ones are the first to assess patients.
Because that's best for the patient and it's also best for flow through the emergency department.
The Health Minister finally admitting the new model was brought in to tackle ramping.
Oh, of course, yes. I mean, that was one of my priorities when I came into the portfolio.
The new process has shaved 3 minutes off the average patient transfer time between arrival and handover to a staff member and boosted patient processing times through the hospital by 10%, meaning 60% are now admitted within the national 4-hour target. But there are fears federal health cuts and a co-payment could put the good work at stake.
Even a small number of people shifting from previously bulk billing GPs and coming into here into our emergency departments could see a tripling of waiting times.
Further work will need to be done to make sure that these changes continue to make inroads into how we need to manage our hospitals.
The SA Ambulance Service says it will continue to monitor the process. Justine Northey, 9 News.